Last week, we reported on the deaths of two construction workers, each killed in closed work zones, two separate incidents. Those two are still under investigation. We don't have any more details there. But while we were reading about things like injuries and deaths on construction sites, we came across a different but related concern. In fact, my next guest calls it a crisis in construction. Tim Worke is CEO of Associated General Contractors, the state's oldest construction trade association. Thanks for your time, Tim.
Yeah, I'm happy to be with you this afternoon, Amy. Thank you.
So when you first told me that there's a mental health crisis in the construction industry, I wasn't quite sure what to think. This is not something I'd really heard much of before, and we hear that word crisis a lot. And then you shared with me two of really some of the most sobering statistics I'd heard in a very long time. Can you share those with our viewers?
Yeah, exactly. And it is a crisis, and we're not overstating this at all. If you are in the construction industry, there is 4 times the rate of suicide than any other peer industry in the economy. So any other industry out there, retail, agriculture, manufacturing, those types of industries, construction has 4 times higher suicide rates than those any other peer industry. And second, being an inherently risk-oriented discipline, construction has 5 times the rate of being killed or dying by suicide than you do in a job site accident working in the construction industry. So both very concerning statistics.
And so you've been you and others have been on a mission to kind of raise the awareness to around mental health concerns to the level that we have in the past historically, and now raised physical concerns on the job site. So how do you it feels like almost a complete change in culture around mental health in your industry. So where do you even start?
Yeah, exactly. That's where we want to start, is to change the culture around construction and around how we view mental health. In construction years ago, we decided that physical safety was going to be paramount, and we decided to invest in physical safety to keep people safe and to give them that opportunity, like everyone else, to return home safely to their family. As we look at suicide, we now tend to view mental health issues through the lens of the individual, and the individual needs to take care of themselves. And we simply push them to the sideline and give them resources and say, take care of yourself, and then come back to us when you're better. And what we want to do is to turn the culture around, bring everyone to the table, and put mental health on the same plane as we have valued physical health, and get us to that same spot.
I want to kind of break this down into a couple of different sections here. First, starting with the worker, his or herself. What are some of the biggest challenges facing workers that are either contributing to the mental health challenges, or do they get paid time off to go see doctors, that kind of thing? What does that look like for the worker?
Yeah, construction, Amy, is really a diverse and different industry than what folks engaged in other occupations might experience, because in some senses it's temporary, it's seasonal in that regard, and it up until recently it did not have those built-in mechanisms to allow the individual to be able to take time away, because the model is built on working as many hours as you can in the industry in order to become eligible for your benefits, your health care. And then if you had to take time away to tend to family business or medical issues, it was lost time hours that the individual was exposed to. But that all changed 2 years ago when the legislature enacted earned sick and safe time and some other safety net programs that are now coming and being onboarded into the construction industry. And those are the kind of things that are beneficial in the industry in providing opportunities for people to take step away and take time away to gather themselves or to seek out resources that they need to be more mentally fit.
And paid family leave, when that kicks in, is that also going to be, will they be able to benefit from that as well?
Yeah, absolutely. You will be able to, in the construction industry now, then take, as in any other industry, be able to take that time away and continue to accrue your benefits and continue to work and continue to receive compensation. But if you have, a sick spouse or a family member or someone that needs care, that you'll be able to do that and not have that burden hanging over you that you will not be able to earn enough money in order to support your family.
Oh, so the infrastructure is starting to be there to allow people to maybe take time off and try to start to take care of themselves. But will people actually do it? I mean, just again, outside looking in, it might feel like there might be a stigma around that, or that your crew is so dependent on you, as you talked about with your timelines and the timetables.
Yeah, that is part of the culture in this industry. It is very much interdependent. Folks work in crews, they work as part of a team. There's been a long history in the industry of a very strong ethos of folks that work as part of that team. And the stigma being, if you need to take time away to tend to your mental health, you're letting your teammates down, or you're letting the employer down. And those things stack up over time and allow people to hide what's going on in their lives. And we need to do better as an industry to address that.
So of the different pieces here, we've got the worker, and then we've got the employer, the person that the worker works for. But then, as I learned from you in kind of learning a little bit more about this industry, they're the project owners, and these are like the MnDOTs or the Hennepin County or whoever is setting the parameters around these projects. What is their role in all of this, do you think?
Yeah, I think the best way to explain this, Amy, to getting our arms around this challenge from an industry-wide perspective, is to think of this as a three-legged stool. And all three legs of the stool are interdependent in construction. You have the construction business owners, who I represent. Then you have workforce. In the workforce component, the men and women who work on the projects day to day. And then you also have the project owner, the organization that is procuring or buying construction services. And on the public sector side, we tend to think of the big project owners, the MnDOTs, the Metropolitan Airports Commission, the Metropolitan Council, county and city governments, those types of organizations. And the reason that they're most important in this conversation is that it is the owner that establishes the project terms and conditions, the days to complete the work, the hours when work can be executed. In the highway transportation side, things like prescribing night work, time away where you have to travel. And when you add up all of those factors, I think it's easy to see that from an individual, from the worker's standpoint, those things tend to press down, especially when you're trying to work, 8 or 9 months out of the year to earn 12 months of pay and benefits. This time of year, especially men and women in the highway and heavy equipment side of the industry, they're working 12-hour days, and they start in the dark in the morning and they end their day in the dark in the morning or in the evening. And then they turn around and work 6 or 7 days a week because we're closing in on the end of the season and the project needs to be completed.
Yeah, it's a complicated sort of layered process here that you're trying to chip away at what you can, but that seems like a big issue because obviously everything I think all of us can relate to the sense of, oh, it's construction season, pretty much year round here, and when are they going to ever be done, and that's tough. There's a pressure there to get things done quickly, but now kind of learning about the cost of that is, again, these statistics are incredible. There is a movement that already exists here in Minnesota to do exactly what you're hoping to do, changing that culture and offer resources like a one-stop shop. It's the Minnesota Construction Industry Mental Health Alliance. A mouthful there, but you are hoping to, and it sounds like you got some money, maybe like $1 million, and some of that you're hoping will go toward bolstering this effort.
Yeah, exactly, and we call it the Alliance for short, but it's an industry effort, and that means that, you know, there are each of the three legs are doing things individually, but collectively as an industry, we need to come together and we need to brand this initiative so that it's identifiable, and then identify a path forward for things that we can do collectively that can help change processes, change culture, so that going forward, years down the road, we will be able to look back and say we made some really foresightful and very impactful decisions early on that have changed the numbers that we started this conversation talking about. And so the Alliance is in its infancy. The legislature last year, we worked in concert with our partners in organized labor to pursue some grant money, and the legislature put $1 million on the table for construction industry exclusively mental health initiatives. And we're hopeful that we'll be able to apply for one of these grants, help this organization get better established, and help us move forward and make impactful change.
You know, just to bring it down to like a really personal level, you know, if there are people watching who either they have a family member who is in this industry or they themselves are in this industry, and this is resonating with them and they're feeling it, what advice do you have for them if it's hard to go to their supervisor, or, you know, what should they do?
Well, you're absolutely right. In that first decision, first of all, I think it's to back away and to recognize that there are resources and that there are people who are there to help, and that folks care about that individual that may be in crisis. But I think, you know, going forward, there will be additional pathways, there will be additional resources that can help us in this space, but we have to start with the culture in the industry and to make it okay to talk about mental health, to talk about challenges in the construction industry, just like we do in the rest of society. But when you have 4 times the rate of suicide, there is definitely a cry and a challenge in front of us that we need to stand up and say, all right, we need to own this, we need to move forward, and we need to find a better way with better outcomes.
And to talk about the future too, you know, these jobs traditionally, because of the unpredictable weather and the grueling conditions and the long hours, they tend to pay pretty well. And so that is such an important, you know, piece of all of this, is that the motivation there is often money, but how sustainable is that as you look at this industry going into the future?
That's a good observation, Amy, that, you know, the construction industry offers as a value proposition that it pays very well, especially in the commercial side, which I represent. But beyond that, there are a host of other challenges as we struggle to find workforce, men and women that want to make construction a career, not just a job. And in order to be a competitive employer, we need to offer something to people beyond just good pay. And we need to be able to be in a position where we value that person as a person, not just for the skills that they bring to the table. And that's because we are competing in construction with every other industry in society. And when you stack those things up that we just have talked through about working conditions, about risk, about travel, about long hours, it gets to be a challenge to find the right person that wants to make this industry a career. So the more we can do to be a welcoming industry, to value people and to value any issues they may have with mental health, the better we're going to be going forward.
All right, just to repeat again, the resource for folks that Tim's talking about here is the Minnesota Construction Industry Mental Health Alliance, Minnesota Construction Industry Mental Health Alliance, and we can put some information on our website as well with this interview. Thanks for your time today, Tim. We'll continue to follow this and see how things go this year with any money that you've received, and how hopefully you're able to find some solutions and make some headway here.
Thanks for having me, Amy.
You bet. All right, take care.